This is Zahir Alam. Welcome you all on Frankly Speaking. My guest today is Dr. Tom Frieden, President and Chief Executive Officer of Resolve to Save Lives. It's a non-profit organization partnering with countries, communities and organizations to prevent 100 million deaths from cardiovascular disease and make the world safer from epidemics. Prior to joining Resolve to Save Lives, Dr. Frieden was the director of the Centers for Disease Control (CDC) and in the Obama administration, and then prior to that he was the commissioner of the New York City Health Department. Dr. Frieden is a national and global leader who has spent over the past 25 years working to improve health in the United States and around the world. He is one of the world's top experts in prevention and cardiovascular disease, tobacco control, tuberculosis, and health policy, also in administration. We welcome Dr. Tom Frieden on Frankly Speaking.
Great to be here, and I'm looking forward to our conversation.
Thank you so much, and feeling privileged that you're here on my show today. First of all, I would like to know about the main purpose of your visit, why you are visiting Bangladesh now.
It's great to be back in Bangladesh, and my focus here has been to look at the cardiovascular disease prevention programs of the government of Bangladesh, with which we partner through the National Heart Foundation of Bangladesh. And in particular, to look at two programs where the government has made a great start. First, in the decision to ban artificial trans fat at the end of this year, and second, scaling up treatment of high blood pressure through community clinics and the Upazila health complexes on a population basis. These are two really important programs that can save literally millions of lives.
So the organizations you're partnering with and the government also you're working. So how you are going to scale up these programs in the coming days?
Well, first, it's a government program, and the government has made the decision to ban artificial trans fat as of December 31st of this year. That's great.
Okay.
This makes Bangladesh only the second country that's lower middle income to pass this type of regulation, following India's action, which came into effect a few months ago, actually. And artificial trans fat is a toxic chemical.
Okay.
It's added to the food supply with no malicious intent, but now that we know more, we know that it kills people. And it killed as many as 500,000 people every year around the world, and thousands in Bangladesh every year. When the government order goes into effect at the end of this year, that will protect every person in Bangladesh from having to be concerned about consuming this artificial chemical that was added to the food. So that's a big win. Now the challenge is to make sure it gets implemented.
How optimistic you are about the implementation, proper implementation of the regulation that Bangladesh government has been formulated?
I'm optimistic. I'm optimistic because Bangladesh has taken a serious decision to do it, because they've thought carefully about how to enforce it, because they've identified that there are only a small number of large manufacturers in the country, perhaps 4 or 5, and so it's possible to ensure enforcement, and there are now testing methods from the World Health Organization that are coming online that will allow anyone to pick up a sample, test it, and if it's not free of trans fat, then encourage the government to take regulatory action.
But the problem is that countries like Bangladesh, the monitoring system is not that much rigorous, not that much, serious. So is there any apprehension that these regulations, when it is going to be implemented in the coming days, you have expressed your optimism, but about the monitoring, do you have any suggestions how to?
3 things. First, to collaborate with the government so there is a strong monitoring framework. Second, civil society groups can pick up products from the market and have them tested in a valid lab. So you can know independently, is there truly elimination? And third, the World Health Organization has started a certification program that validates a country as you're certified to be polio-free or smallpox-free, validates a country to be trans fat-free. And that's a very important step that I think motivates governments and civil society to show real progress and leadership in this area.
So awareness and building modern laboratories is critically important for that implementation.
It's a civil society advocacy and government work to make sure that industry complies with the government's order.
Dr. Frieden, tell me about something about the prevalence of a hypertensive reality in the countries, low and middle income countries like Bangladesh?
Hypertension is a pandemic that's even deadlier than COVID at its worst. Hypertension kills more than 10 million people each and every year. More than 80% of those people live in low and middle income countries, and most of them die at a relatively young age, in their 40s or 50s. So we have a huge pandemic of hypertension, and it is neglected. It is the silent killer because you cannot know if your blood pressure is elevated. And yet treatment of high blood pressure is safe, it's effective, it's inexpensive, but sadly, globally and in Bangladesh, until recently, it hasn't been getting done.
What's the reason?
Well, on the one hand, all over the world, we have pretty weak primary healthcare systems. On the other hand, even where we have strong primary healthcare systems, we don't see those systems focusing on the most important conditions to save the most lives. We may address patient needs, we may address other things, and there's been a switch globally from mostly infectious diseases to mostly non-communicable diseases, heart attack and stroke in particular, and hypertension is the single leading driver of those conditions. High blood pressure is deadly, and we need to transform the way individuals, including doctors and nurses, think about it. A slightly elevated blood pressure is not a small problem. It's a life-threatening problem that has to be addressed.
So knowing the fact, as it is so much deadly, so much killing, so why you were not taking proper action? Where is the negligence lie?
Well, it's hard. So if you look at the best healthcare system in the United States, a group called Kaiser Permanente. It's a nonprofit group that does a superb job. Before they focused on hypertension, among their beneficiaries, only 4 out of 10 had it controlled. They realized it's not enough to have good primary health care. You also have to focus on hypertension. Choose a regimen to follow. Make sure there's enough medicines. Make sure that you have the whole team involved, the doctor, the nurse, the pharmacist, the community outreach worker. Make sure it's easy for patients. Don't force them to come back every week or 2 weeks or even every month. When things are stable, give them 2, 3, or 6 months of medications. And perhaps most importantly, rigorously monitor. So we learned from Kaiser Permanente, they started at 40% control. And when they did those 5 things, they steadily improved to 90% control. Around the world, we see countries, even with very good primary health care, not controlling blood pressure well. So you need both things, a good primary health care system and a focus on hypertension, having enough good medicines, making it easy for the patients, using the whole healthcare team, making sure you have an uninterrupted supply of medications, and systematically tracking how you're doing. Because when healthcare workers can track it, they can improve the care that each patient gets, and they can improve the program overall.
As you're partnering, I mean, Resolve to Save Lives is partnering with Bangladesh or other organizations who are dealing with these deadly issues, deadly menacing diseases. Do you think that Bangladesh and the partnership with the Resolve to Save Lives is meaningfully or productively being implemented?
I'm really encouraged. I was out to Sylhet yesterday to visit some of the facilities that have begun implementing this program. And despite COVID, which really set back services all over the world, it's been able to expand. When we started this program in a tripartite collaboration among the government of Bangladesh, the National Heart Foundation of Bangladesh, and ourselves, Resolve to Save Lives, we started in just 4 Upazila health complexes. Now the program is in 51 Upazila health complexes.
Oh, that's fantastic.
So it's really expanding. It still has some teething pains. It still has to optimize the program and make it easier for patients and more effective, but it's impressive. You're seeing hundreds, thousands, in fact, around today, by coincidence, around today, the program will enter its 100,000th patient in treatment.
Oh, fantastic. That's a great.
And the government has bought all of the medicines. We provided initially some very high quality blood pressure monitors. The government saw those and said, yes, those are good. They're buying hundreds more of them. We have staff who we support through the National Heart Foundation, the government support staff, and you're seeing really good services for patients. I'm also very encouraged by this move to strengthen the community clinics with the community healthcare providers. These have enormous potential because you'll never get people coming in huge numbers to the hospitals. It'll just overwhelm the hospitals. the key to success is decentralizing to these community clinics. And in fact, I've just come from India. They've been doing this program for about 5 years.
Okay.
And they've had a lot of learnings, a lot of progress. And one of their most important learnings is that when they decentralize to their equivalent of the community clinics,
Okay.
which they call as health and wellness centers,
Okay.
the likelihood that a patient will be treated well enough to control their blood pressure doubles.
Oh, that's fantastic. Dr. Friedman, we'll discuss more about how to scale up these efforts to have a more better results in to arresting or dealing with hypertension. So, Dr. Friedman, we're talking about how to scale up the efforts we're having right now in Bangladesh. There are a lot of, practical challenges in dealing with hypertension. We have a huge populated country, and in statistics we find that 1 in 5% or 7% is hypertensive. So there's a strong prevalence of hypertension in Bangladesh, and a lot of people are facing problem in having medication or treatment. You are supporting, but despite of having all the facilities, we are having infrastructure and other. What are the real challenge for Bangladesh? How do you see that?
Well, to do this program well, you need a comprehensive program.
Okay.
And in these 51 upazilas, we've seen this program begin to get implemented. And the initial results are quite encouraging. When you look at the population survey in Bangladesh, only about half of people with high blood pressure have been diagnosed and know they have it. Only about 1 out of 3 are on any type of treatment. And only about 1 out of 7 have their blood pressure controlled. So you have about 2.2 crore, about 22 million people with high blood pressure in the country, and only maybe 2 million, 1/10, 1/7 maybe, have it under control. In these areas, among the patients coming in for care, up to 60% have their blood pressure controlled. That's quite a good result. So for the patients who are continuing on treatment, you're seeing the majority controlled. And those people will have lower risk of heart attack, stroke, kidney failure, and other serious problems. So the program is showing the way. I think over the coming months and couple of years, it will be important to optimize the program to figure out how to make it as easy as possible for the patients, as easy as possible for the healthcare workers, and make sure the government has the resources, technical, operational, and financial, to implement and sustain the program across the entire country.
But that's the key thing, financial resources. How Bangladesh government can manage all the huge amount of financial resource to deal with the challenge?
As I have looked at the data, it looks like of all government spending on health, if I've seen the numbers correctly, is a little under 6%.
Yeah.
So of all government spending, not a lot goes for health. And then of that 6% going for health, very little goes for the non-communicable diseases. But you have a commitment from the highest level of government to create these community clinics. And the community clinics are your best chance to get a high level of control of hypertension, diabetes. And when you do that, you're going to save money, because there are fewer people who are going to come into your hospitals with heart attacks and strokes and kidney failure. People are going to be more economically productive. And the medications can be very low cost. What we've seen is when you increase the volume of purchase of medicines, the price comes way down.
Okay.
So the best medicines in the world for hypertension are included in the program. There's no second-class care at all. In fact, the first-line medicine that's used, I use for my hypertension because I have slight elevation of blood pressure, so I take that every day. Same medicine that is provided all over in these 51 upazilas, free of charge to patients. And it's quite inexpensive, as it turns out. All of the most effective medicines to treat blood pressure are generic. And when you buy efficiently, you can get very low costs. Now, many people with high blood pressure also have diabetes, so they may need diabetes medicines as well. And it's very important for someone who's quite high risk, such as anyone who has both hypertension and diabetes, to be on what's called a statin, atorvastatin, for example, which lowers the cholesterol and greatly reduces the risk of a heart attack or a stroke. So the medications are relatively inexpensive, and it's a best buy for the healthcare system, because by spending money on this, you decrease the need to spend money on tragic and preventable heart attacks and strokes.
But how to aware people more about these deadly menacing diseases?
Interestingly, what we find in Bangladesh and elsewhere is people are aware. I was in Upazila Health Complex yesterday. There couldn't possibly be more patients coming in. Hundreds and hundreds and hundreds of patients coming in every day. That's why it's very important to decentralize to the community clinics. In the community clinics where you have 5, 7, 8,000 people, as treatment scales up in those clinics, people hear about it. When treatment of high quality is offered, especially if it's offered free of charge, the patients come from far and wide.
Quality of physicians, experts,
Well,
medical workers?
It's interesting. What we find in even the best, most expensive healthcare systems in the world is that following protocols is very important.
Yeah.
The protocol is agreed by the experts and then it can be followed. First this medication, then this medication, then this medication. Best protocol in the world, as long as it's followed, the care will be the best in the world.
But as we have seen in the COVID time, the maintaining or following the protocols is the very gigantic and toughest thing ever in the countries like Bangladesh.
At Resolve to Save Lives, we talk about simplicity, speed, and scale. If you keep the protocol simple, you can quickly scale it up to an entire population. In addition, in Bangladesh, we're partnering with an app called Simple. And it is just that. It's simple.
Oh, okay.
And it allows the healthcare worker.
Oh, it's already in the App Store.
It's already on Google Play.
Okay.
It allows the health worker to track. It's for health workers, not for patients.
Oh, okay.
But it allows the health worker to track every one of their patients. And the data entry just takes 15 or 20 seconds for the follow-up visit. And this allows the program to know how they're doing and to continuously improve their performance. And if there is a failure to follow protocol, you can identify it and fix it.
Are you happy with the way it's going? I mean, the partnership is going on with Bangladesh government.
I'm very encouraged. I'm encouraged by the trans fat action. I'm encouraged by the partnership on scaling up hypertension treatment. I'm encouraged that the government has actually increased substantially their commitment and their funding of medications for high blood pressure and diabetes, and they've bought these high quality blood pressure monitors. I'm encouraged by the community clinics, which can be an essential tool for the community control of high blood pressure. So I'm optimistic about the further progress of this program in Bangladesh.
Oh, they have enough enormous attention with that.
I think we have to ensure that as time goes on, we continue to optimize the program, make it steadily better as it expands from 50 to 200 to every part of the country.
Dr. Frieden, we talked about limiting trans fat and the challenges posed by the hypertension in our society, in our country. Also, salt reduction is an important area, which you are also dealing with, I heard.
High sodium consumption is quite dangerous, and it causes hypertension and shortens the life expectancy. The challenge is, how do we reduce salt?
Okay.
There are things that everyone can do in their own cooking. For example, when you're making rice, don't add salt while it's being cooked. You could add a little bit of salt at the table if you need it. You can use other spices or lemon. But reducing salt is really quite important because sodium intake is far too high. It's about twice as high in Bangladesh and this region as the World Health Organization recommendations.
Oh, okay. So, I mean, is that only that we propagate or make people aware to reduce or use salts in their day-to-day life in cooking or any other areas? But is there any compulsion or promulgating or enacting any regulations so that the use of salt can be reduced? Is there any way?
We've looked at this from around the world, and a few countries in South America, Chile, Argentina, Mexico, have passed what we think are best practice regulations for packaged food,
okay,
where the producers are incentivized to reduce their levels of salt and other harmful ingredients, because if they don't, they have to put a big warning label right on the front of the pack. And we don't want to punish the industry, but we do want to encourage them to make their offerings healthier. And what we see is every 2 years they change the levels. So the industry can have a planful approach to making their food healthier, and this is one very promising approach. Another promising approach we've used in partnered with many countries to do is to say anything the government buys with its own money or subsidizes with its own money or serves on its own property must meet the government standards for healthy food, which includes lower sodium levels.
Dr. Frieden, we have so far discussed about the issues you are dealing with as President and CEO of Resolve to Save Lives. But we know that you had a big responsibility. You were director of the Center for Disease Control and Prevention. You are the commissioner of the New York City Health Department. So, taking into consideration that responsibilities you discharge, we are facing a severe pandemic time, and still we are in this menacing problem. So, how we get over, how we can deal with in the coming days this epidemic situation?
Let's talk about COVID first and then preparedness more generally. In terms of COVID, the current dominant variant is highly infectious. Just when you think this virus can't get more infectious, it gets more infectious.
Okay.
But there are three things that have happened. One, many people have been vaccinated, and I encourage everyone to get vaccinated and up to date. Two, many people have been infected, and this also creates some protection. And three, this virus, this strain may be less severe. So the vaccine may not prevent your infection, but it may prevent you from going to the hospital or dying.
Okay.
The fact is that with COVID, it's changing very rapidly. And anyone who tells you with confidence that they know what's going to happen more than a month in the future doesn't know what they're talking about. Because we could see this variant become the dominant and fade like the common cold. We could see a terribly deadly variant come in 2 months or 2 years or 5 years. So we have to be ready to adapt, and that brings the broader issue of preparedness. And we suggest a global target that we call 717. Every single outbreak found within 7 days of emergence, reported within 1, and all essential control measures in place within 7. If that had been in place, COVID would have been much less severe, monkeypox would have been found and stopped. Every country in the world needs to measure itself by the benchmark of is it finding problems quickly, reporting them promptly, and stopping them quickly.
Another thing, as a commissioner, you dealt with the public health issues in New York City. So as a low and middle income countries like Bangladesh, generally our infrastructure supports, facilities, policies, resources, these are a gigantic challenge for Bangladesh to deal with public health issues. And also in the pandemic time, we have seen a lot of the weaknesses or the fragility in our country. So as a whole, how do you view the overall public health challenges in Bangladesh?
I think Bangladesh is doing better than its income level would predict. So if you draw a line between health and wealth, it's usually correlated quite closely. Bangladesh is a positive outlier there. So it's healthier than its income level would suggest. In order to make even more progress in public health, it's important to emphasize and act on the most important problems. Tobacco control. You still have a big problem with tobacco. Increasing the tobacco tax, enforcing regulations on sale of small numbers of cigarettes. There are proven policies that will save a lot of lives and also get the government more revenue. So increasing the tobacco tax is very important. Measures like the trans fat regulation, making sure they get implemented, very important. Addressing road safety, also very important. And I think the hypertension program is also extremely important. Reducing sodium consumption, increasing the number of people on effective treatment, looking at that number, that only 10 or 15% of people with hypertension are well treated now. Can you increase that to 20%, 25%, 30% in the next 10, 15 years, meeting the Sustainable Development Goal for a healthy population?
Dr. Frieden, we're almost at the end of our conversation. The one thing, the world is now facing an economic downturn due to war and other issues. So do you think this economic downturn or this scenario will impact or affect the public health challenges around the world, especially the countries like Bangladesh?
Unfortunately, yes. We know that health and wealth are related. If there is an economic downturn, it is reflected in health statistics all around the world. That's why it's extremely important to double down on the most important, highest impact public health interventions like tobacco tax, hypertension treatment, trans fat elimination. These are things that save money and save lives.
Okay, and finally, your what are the memories you're taking back home? You are visiting Bangladesh for a long time.
Yes, you know, with 2.5 years of the pandemic, we weren't able to travel. None of us were able to travel. It's great. What I will certainly remember is the huge number of patients being treated for hypertension at the Upazila Health Complex, and the great potential of treating even more patients even better by decentralizing that care to the community clinics.
Thank you so much for your insightful information and the issues you are dealing with. We wish you all the best in the coming days. Thank you so much, Dr. Frieden.
Thank you. It's been a pleasure to speak with
Yeah,
you.
my pleasure. Dear viewers, that's all my conversation with Dr. Frieden. We have learned the challenges in arresting hypertension and other critical issues. As a physician with advanced training in internal medicine, infectious disease, public health, epidemiology, Dr. Tom Frieden has taken the gigantic challenge to support the people of Bangladesh who is in need. Also, he is supporting in many countries from Resolve to Save the Lives. So that's all, and we are wishing that the issues Bangladesh government is dealing with hypertension will be a big success in the coming days. Thank you so much for watching this show. We invite you to watch our next episode. Until then, do take care and watch our next show. Thank you so much.